Diversity in healthcare matters. Research shows minority physicians are more likely to practice in underserved areas where the needs are greater. And that can lead to longer life expectancies and better health outcomes in communities that need it the most. The challenge is there are not enough doctors of color. Fewer than 6% of physicians are African American, and the number is similar for Latino physicians. A new program at the Medical College of Wisconsin is changing those statistics and working to improve health outcomes. The Health Equity Scholars Program supports students in their efforts to become physicians and provide better medical care. Let's learn more about the program now from Dr. Michael Levas. He is a Medical College of Wisconsin professor of pediatrics and emergency medicine and one of the members of the planning team launching the Health Equity Scholars Program. Thank you so much for being with us.
Oh, thank you for having me.
Why is this the right time for the Medical College of Wisconsin and your partner organizations to launch the Health Equity Scholars Program?
So now is the right time because at the Medical College of Wisconsin, we've had a long track record of having pipeline and pathway programs that expose our youth from the city, from underrepresented groups, first generation in medicine, to healthcare to try and increase the interest. But what we haven't seen is that translation into actual enrollment in medical school. And specifically enrollment locally. So we have a lot of our youth that we expose to healthcare, they decide to get into healthcare, and then for some reason or another, they decide to train in another city and practice in another city. When we were, thinking about how do we operationalize a program like this, we talked to our students of color who were at the medical college. We had focus groups. We spoke with community leaders, and we tried to figure out what would be attractive, what would get our local talent, right, really interested in not only training here, but practicing here. And we came up with the Health Equity Scholars Program in conjunction with our community partners, in conjunction with a lot of student leaders. It really evolved into a program that started. We have our inaugural group that started in July. We have 5 wonderful scholars who have ties locally or are really rooted in a health equity interest. And our goal is to really train the future leaders. As one of the co-directors of the program, I would love for the Health Equity Scholars to take over the program, right? To keep it going, to be the mentors for our local youth that are interested in becoming physicians and want to practice. And like you said before, the outcomes of patients improve when there's a lens from the providers that's similar to that patient's, right? So we know that there's more concordance in terms of empathy, in terms of holistic care, in terms of trust. That's what we're hoping to enhance in Milwaukee.
What are some of the criteria for young people who want to take part in this program?
Yeah, so our program is separate from the admissions process. So every single one of our scholars was separately offered admissions by our admissions council. What we do is we offer this program to everyone who's admitted to the medical school, and then we have a secondary application process. And we weigh the things that we know based on the literature are predictive of who is going to probably stay to practice in Milwaukee, or practice in Milwaukee, practice in the health equity area. So we're looking for students that grew up in the area. We're looking for students that grew up in the state. We're looking for students that have had, our first generation. We're looking for students that have had any kind of economic hardship. And then also, we're looking for students that have a deep wanting to work in health equity spaces. Part of the application is writing up a plan of what your ideal project would be in this community in Milwaukee, and demonstrating an understanding of the resources that are available in Milwaukee and the opportunities and all of the wonderful things and communities that are present. That's all part of that application. And then I think the most special part of our application is, or our process is, that we don't have just physicians on our selection committee. We have current students, and more importantly, we have had 3 community leaders. These students were picked by the community, picked by Milwaukee, saying these are the doctors we want, which I think is a pretty novel approach to programming.
In addition to the scholarship, which clearly is very important, it helps students, it removes a barrier, and it helps students eliminate or reduce the amount of student debt that they will have, which is not insignificant when you're talking about medical school. But you also create a sense of community amongst the scholars, even giving them the opportunity to live in a shared space. Why is that sense of community particularly important to this program?
I think it's important to all medical students. I think the traditional approach to medicine, medical training is classwork and, get the job done, get good grades. But we have, once you get into medical school, you're already at the top 1% of all academic graduates, right? So we have a highly competitive space where I think the approach with our Health Equity Scholars program is the community has chosen you to be a part of this group. It's not your job to get through. It's our job as a medical school to train you for the community, to help you get ready to practice in the community. We borrowed that approach from the Milwaukee Fire Department. They were having trouble with keeping cadets in the city of Milwaukee until they changed their approach to having community members choose who their cadets would be, and then thinking differently about it's more the institution's duty and job to make sure that those individuals that are chosen by the community become the doctors of the future for that community. And part of that living learning experience, we want to build a sense of family, a sense of community, a sense that really everyone is in this together. And, if you look at community practitioners, they already have that approach. They already are really deeply rooted in the community, whether that be in, in a city community or in a rural community. I mean, most physicians that are in those spaces, they put roots down. They've developed relationships. They get close with the other physicians as partners in that community, and they know who they can trust, who they can talk to, and who they can recommend their patients go to. So we wanted to really foster the sense of community within this community building program, right? And one of the great things that's an option for us being partnered with Thrive On King is that there is our living spaces there where our students could live within the community with it by the organizations that they are developing projects with and doing research with the patients that they're going to see in the local clinics right across the street from Howard Fuller School, where those students can see, oh, not only is this medical student, training and learning, but they live here, right? They live in this community. So we felt that that's very important. There are other academic areas that have done kind of living learning communities, and they've shown very promising outcomes. We are one of the first in the medical training field.
Well, let's hear from one of the Health Equity Scholar Program participants now, Alex Martinez. Alex, you are one of the first to participate in this program. What made you decide that this was the way you wanted to approach becoming a physician and your training?
Well, I think the Health Equity Scholars Program was very appealing to me because, growing up in Milwaukee, I was raised in impoverished areas, and I had a firsthand I observed firsthand how, depending on where you live in the city or like where you reside in the city, that can really affect your health. And when I was little, I didn't understand that, but growing up, I saw how it was how it was very important. MCW with the Health Equity program was very appealing to me because I think it's going to serve as a catalyst, providing not only a shared foundation but also serve as a nurturing system. As Dr. Levas said, our team is composed of students, coordinators, MDs, community leaders who are mentoring us and guiding us in refining our unique strengths. They're also helping us to connect with various resources, and that way we can be as most impactful as we can. And our shared goal, as well as with my cohorts, pretty much just to make Milwaukee a place where we can grow, live, and learn in health, regardless of where you reside.
Is this something that you think it's possible to reach that goal because of this program? If it wouldn't have been for this program, do you think that would be something you were still searching for, right? That feeling, that knowledge that you can make a difference?
Well, I think this program really just is very helpful because it allows us to, it gets like five medical students each year. And, we all have a shared goal. We might be all different, but we all have that shared goal and wanting to improve the health of our community. And let's say if we didn't have this program, maybe we wouldn't be able to meet each other. We'd all be be doing different things. But in this way, we can all focus our efforts together, and that way just propel all our strengths. And we're able to also have other resources offered to us that otherwise probably wouldn't have been offered to us if this program wouldn't have been standing right now.
You feel it sets you up for success?
Correct. I think it's going to definitely make me a better physician that I was going to treat the Milwaukee and its residents in a more efficient way.
Well, Alex, we wish you the very best as you continue on this year and through the rest of medical college and medical school and your residencies. We thank both you and Dr. Levas for being here with us today.
Thank you for having us.
Thank you.
For more information on the Health Equity Scholars Program or to support its work, visit the Medical College of Wisconsin's website at mcw.edu and search for the Health Equity Scholars Program. Stay with us. We're right back.